What's up, you guys? Rex here. So this past week in medical school was a cool shift in my curriculum from process-based, such as like inflammation or neoplasia, to system-based, where we talked about the central nervous system this week. And in particular, I want to share with you how our treatment of bacterial meningitis is such a cool win for modern medicine. So tragically, not that long ago, bacterial meningitis is something that was almost 100% fatal. So what bacterial meningitis is a bacterial infection of the meninges, which are the layers covering your brain and your spinal cord. And this is a part of your body that it's pretty difficult for your immune system to get to and actively fight off an infection, but it's also a very delicate part of your body that you need your brain and you need your spinal cord functioning in order to live. And so when things go wrong, there can be very tragic outcomes. But thankfully, modern medicine has done a lot to improve our treatment and prevention of bacterial meningitis, which is really exciting and cool for me to learn about as a medical student and future doctor. So first, as far as treatment goes, we now have antibiotics that work very well at reaching the central nervous system and treating the most common bacterial pathogens causing bacterial meningitis. So we have third-generation cephalosporins, we have vancomycin, we have ampicillin, and these all work very well depending on what specific organism is needing to be treated that is causing the pathology. Additionally, we have awesome prevention strategies in the fact that we have vaccines for pretty much all of the most common causes of bacterial meningitis. We have the pneumococcal vaccine, which prevents Streptococcus pneumoniae from causing bacterial meningitis. We have the meningococcal vaccine, which prevents Neisseria meningitidis from causing bacterial meningitis. And we have the Hib vaccine, which has been a huge win in preventing meningitis caused by Haemophilus influenzae type B. And these have all worked incredibly well at preventing cases of meningitis that would often be fatal for patients. But I also really enjoyed learning about meningitis this week because it was such a good example of sort of the strategy of modern medicine and how we approach diagnosis and treatment for diseases. So meningitis is something where you could look at a patient and listen to the history of the disease and have a good guess of what might be causing it, and you would have to take into account the demographics that different pathogens are more common in infants versus an elderly patient versus a child versus a teenager versus an adult. Additionally, you can do some very interesting physical exam maneuvers that may point you towards that person has a meningitis, and you can do various exam findings that would point towards meningitis. So you can combine the history taking plus the physical exam, but then ultimately you have to do a lumbar puncture and send that off to a laboratory, which is something that only modern medicine has been able to do. And you can look for and see whether there are lymphocytes present or are there mostly neutrophils present. And then you can actually do a diagnosis to know exactly what bacteria is causing the problem. And so you can then do a test of, all right, what antibiotics is this bacteria vulnerable to that will work effectively against it, and then you can provide that treatment to the patient. And that sort of combination of history taking, physical exam, and then actual laboratory medicine all coming together with actual prevention and immunotherapy in the form of vaccination is really cool to me, and I'm excited to partake in this really effective treatment of diseases as I go forward in my career in becoming a doctor. So if you have any questions, comments, or concerns, I'd love to hear about them down below. If you want to catch more of my videos just reflecting on what I learned in a week of medical school, make sure you subscribe, hit the notification bell. As always, like the video if you like the video, dislike the video if you dislike the video. Until next time, don't be ordinary, go be great.